Good afternoon, team. Otieno, confirm you can hear me.
Yes, Sungok, I can hear you.
All right, thank you.
I can hear you, Sungok.
Thank you. Right, so I can see we're still so few in the call. I would request that we can reach out to our other colleagues to join this call. We are about 54. Otieno, confirm that's the correct number. I think we are about 54. How's that now? 56? That's correct?
Yeah, 56.
Okay. Yeah, and our expectation is that we are expecting about 1,000 participants. So I'll request that we quickly reach out to our other colleagues and proposed to start this training at exactly 2:10. So let's take this 6 minutes to mobilize, and then we should set to begin at 2:10. So otherwise, let me take this opportunity to welcome all of us. My name is Franklin Songok. I work at NASCOP SI. I do support HIS. So let's take that time to mobilize, please. We will begin at 2:10. Thank you. Yes. Good afternoon once more. Otieno, I need some guidance. We are at 101, just slightly above 100. Given our expectations, I think we are about 10%. So, Otieno, I don't know. Do we begin? Do we continue, or we still wait?
So I think we can just proceed. I think the rest will join as we proceed.
Okay. Thank you. Thank you for the guidance, Otieno. Yeah. So, good afternoon once more. I think I'd done a bit of an introduction earlier on, so we are set to begin. But I would still urge us to keep mobilizing, keep reaching out to our colleagues. We also recognize the fact that would be groups of colleagues who've joined, probably from a facility. So we appreciate that, and we say thank you for just pulling resources together so that you can be able to attend this virtual training. So this is our second series of the many series that we've lined up to just build the capacity of our service providers. We had another virtual training last week, and this is a follow-up of the webinar that we had about 2 weeks ago, just to ensure that we build the capacity of everyone and make all our service providers competent enough to be able to utilize the EMR. So today we will be discussing on billing and billable services. And we'll also be able to touch on e-claims. We'll focus majorly on the bill creation, the bill processing, billable services, and how to set up those billable services. We'll also be able to touch on waivers. We also appreciate the fact that there could be one or two patients or or clients who may not be able to pay for the services that they've received. So we should also be able to guide you on how to go about waiving within the system. And finally, we should be able to then touch on e-claims, just like I'd already mentioned. We may not be able to allow all of us to introduce ourselves, but I think before you join this call, we had requested that you register, so that would help us in terms of just taking note of who has attended and of course just keeping track of our capacity building. Allow me to share our agenda for today. Just give me a second. Yes, a minute. I seem to have opened so many documents. Sorry. So Oh, it's 18th. But you're not confirmed that you can see the agenda.
Yeah, I can see it.
All right, thank you. Yeah, so this is the agenda for the day. Our expectation is that we should be able to cover this in the next 2 hours. So we hope to end this training by around 4. Our training objective basically are to showcase how to configure various billable services. I think I've touched extensively on the forecast areas. We should also be able to do a demo on the same areas that I've mentioned. And then we should be able to do some illustration on e-claims and claims management within KenyaEMR. So I will call upon a few of our colleagues in the call. I'm hoping that they've managed to attend. I know there are so many other engagements that are going on. To do some quick remarks. I think I've already taken you through the objectives. After that, I will call upon Otieno, who will take us through a slide deck to just prepare us on what to expect during the demo, and then the demo part will be guided by Marianne Mwangi and Rajab, both from Palladium. So Marianne will take us through the billing configurations, the billable services, and bill waiver process. She'll also be able to touch on the payment workflow and how to just process the bills. And then finally, Rajab will take us through the e-claims and the claims management. Then after that, so we will go through this uninterrupted. So once Otieno takes over, I'll request Otieno to, once he's done with the presentation, he'll be able to usher in Marianne. Marianne, once you're done, you usher in Rajab. And then once we are done with that, we will open it up for Q&A. And then I think that should be it for this virtual training. So I want to quickly request, I don't know whether George or Wizo from Palladium has managed to join to just make a few remarks before we begin. George? Yeah, I can see George is not in the meeting. Yeah. All right. Okay. Yeah, I can see George is not in the meeting. I don't know whether we have anyone from DOD, any of our colleagues from DOD, Gonza, or anyone, Lydia. Sorry, I'm not able to scroll through the list. Anyone from USAID? You can raise your hand so that we can give you the mic. I know we muted everyone just to be able to manage the training properly. So if you're in the call, you can raise your hand. I don't know, CDC. I don't know that Daniel Mahangi managed to join. Yeah. For the county teams, I don't know whether we have any CHRIO in the call. You can raise your hand. Okay. Any CHRIO? Or I'd seen Mike in the call. Okay. Any Casco? All right. Anyway, we'll give them an opportunity to speak once they join. So at this point, allow me to welcome Bernard Otieno, who will take us through the first bit of the presentation. Otieno, once you're done, just like I indicated earlier, you usher in Marianne, then Marianne will usher in Rajab. So thanks. Thanks from my end, and over to you, Otieno.
All right. Thank you very much, Sango, for the introductions. I'll just proceed and share my screen and kindly confirm if it's visible from your end. I will confirm if it is visible from your end.
It is not. I guess it's still loading. Or someone else can also confirm, because probably my network may not be very stable, but I can't see it.
It's not yet here.
It's blank. It's blank.
Still blank, yeah.
Let me share again.
Okay.
How about now?
Not yet. Yes, it's now okay. I can now see your screen. Proceed.
All right. So good afternoon, everyone. One more time. So today, just like Songok has indicated, we are going to take you through the billing module, which entails the billing, bill creation, bill processing, and bill payment, and the entire continuum on the bill management in a facility. And this is part of the series, the virtual training series that we are undertaking for this quarter, where we are intending to take you through several other modules in the facility at KenyaEMR, so that we can be able to, in collaboration with the NASCOP and the Ministry of Health, we will be able to kind of build the capacity of our service providers and the end users of these particular solutions. So without much ado, I'll just go through a few slides, and then I think we'll pave way for Marianne and Rajab to take us through now the actual illustration of how the module is supposed to be configured, how it's supposed to set up the billable services, and everything that entails the bill processing. So take your time, take a pen if you have a notebook, so that we can go through this together. Again, I think Songok had already shared. This training is being recorded, and we hope that
Otieno, are your slides moving, or you're doing an intro?
No, not moving yet.
Okay.
Yeah, so the meeting is recorded. So if any of your colleagues maybe was not able to attend, they'll be able to find this on YouTube tomorrow. Yeah, so I think I'll just proceed from there. So for the slide decks, I would like to take you through the introductory session of the billing module in KenyaEMR3.x, looking at some of the key features and also why it is important for the facility to adopt and utilize the billing module in KenyaEMR, and then we'll pave way for the demonstrations. So the facility at KenyaEMR has got several other modules. Last week we had looked at the stock management module together with the pharmacy drug dispensing aspect of it, and today we are looking at the billing module, which is one of those key modules within the KenyaEMR. And we want to just take time and take you through that, so that everyone understands how to operate and use that particular module. So the billing module itself is that component of KenyaEMR that seeks to automate the financial aspect of the facility, especially for the facilities that are charging for services. So in a way, it kind of eliminates the manual method of billing, where guys have to write stuff down on some paper, and then you see that it kind of removes or eliminates the audit trail. So with this module, you can electronically create bills, receive payment from patients for those particular services, and then this is tracked electronically, and you can have like historical view of how the facility has performed over a period of time financially. So it's a very important module, to say the least, that you may want to also take time and adopt. So besides streamlining the operations, it also reduces the administrative workload, especially when it comes to tracking of the claims and the claim the entire claim management, because it kind of minimizes the errors that may be introduced if you would be using the manual way of doing things. So some of the key functions of this particular module, it automates the bill creation. So there's no human interaction in terms of setting up the bill for different services. All this during the setup, and you'll be able to see this when we are going to the demo. Once you set the price tag for, let's say, a service or a commodity, that's all it takes. So anytime that particular service or commodity is utilized, the bill will be created automatically. So and that brings some sort of standardization, so that if Panadol is 5 bob, it is 5 bob for everybody. Okay, so that's one of the key functions that it has, and it also supports electronic invoicing and receipt generation. And one aspect which is very important is the aspect of the ability to print using the thermal printers that I think are really available across different facilities. So that is really very important, and also it helps in payment processing and tracking, using different payment options that are available. So you can choose to pay through mobile, through insurance. I'm told of late cash is really discouraged across different facilities. So you can have payment done through mobile or through the insurance. Again, the aspect of bill waiving process and the claims management is key part of the billing module functions, which allows for that for recording of waivers, which again also forms part of the reduction in the patient, in the amount the patient is supposed to pay, or if at all the facility is willing to waive the entire amount, the system can still accommodate that and make and have like a track record of that within the system. That also goes for the claim management, where the facility is able to process claims electronically based on the services that they're provided, especially the insurance. Like now we're talking about SHA. So if maybe there's claims for services provided to clients that are registered to SHA, then the facility is able to now submit those claims electronically based on the service provided, and then they'll be able to receive their dues appropriately. Billing module is easy to configure, and you are able to configure the billable services and commodities, and you'll be able to see that. And at the end of the day, the system provides you with a lot of fiscal reports, that both for the facility and also for the above facility. Like we have dashboards for the county and also for the sub-county. We will have dashboards for the governor to kind of look at what is happening within the county in terms of revenue management, and also in terms of other reports that are related to the county. So the module itself has a lot of benefits for facilities if it's adopted and utilized well, in terms of improved efficiencies and also enhanced accuracy within the system, because it eliminates the human aspect in terms of the billing and also the tracking of the bills. And it also kind of provides better financial management for the facility as a result of those automated reports that really support facility in decision making when it comes to facility finances. And also the dashboards of the county also improves the county visibility within that particular county in terms of how facilities are performing. Yeah, lastly, for the patient, it's very important because it kind of creates transparency in the billing processing, so that one patient doesn't say that I think I was overcharged or I was undercharged or something like that. Once the pricing is set for particular commodity, then it's standardized for everyone. So that kind of creates a lot of trust and confidence from the patients when they are sure that they're really being fairly charged for fair services that are being provided. And should they want to access their billing history, the system provides that, and also the convenience that comes with it in a way that the system supports the SDK push. That means that if the patient is being asked to pay, they don't have to send the money, but they just prompted to input the M-Pesa, the mobile PIN. For now, M-Pesa is supported, so they just put in the M-Pesa PIN and then the payment is done. So that will be done from the M-Pesa account. Yeah, so with challenges, I think everything that we do comes with a fair share of challenges, but we have experienced very minimal challenges when it comes to the customization needs for this particular module to fit the requirement of all the facility levels. So we have from level 2 all the way to level 6 facilities, with every level of facility requiring different configuration and customization of the module. So that has been a lot of back and forth to ensure that the module is generic enough to accommodate different requirements based on different facility levels, especially when it comes to bill waiving process. I think that was one that really stood out. Different facilities have got a different process of waiving bills for their patients that are unable to pay for a reason or two. So I think that was really one of the challenges in terms of customization. And again, also there's the integration issue, especially for facilities that have existing billing module or would like to integrate the billing module with their existing one. So that has also been an issue. And also the issue of capacity gaps, especially in terms of how to utilize this particular module accurately and effectively. You remember that this is not the first time. Sorry?
Have you started moving your slides?
No, it hasn't moved yet.
Oh, it hasn't moved yet. Yeah. Okay. So
Yes. Where are we? What are you seeing on your screen?
the first slide on overview, billing and billing process module.
No, I think it's supposed to be moving because I'm almost.
That's why I asked you. That's why I asked you earlier whether you're showing the slides, and you said no, so I could quiet. So I think all of us are not able to follow the slideshow. Okay, now it's moving.
Really?
Yes, now it's moving.
Yes, but I think we can share the slides after this. But I think I was audible enough. So I was talking about the final challenge with the billing module. As I was saying, that this is not the first time that we are taking users through the module, but it is we are purposing to keep on taking guys through this module, the billing module, and even other modules within KenyaEMR3.x to ensure that everyone has the capacity. So the capacity gap has been there, but we also we are up to the task to ensure that we are able to build your capacity. Yeah, so up to that point, I think I want to transition it to the demo so that we can see how to utilize this particular module. Sorry if the slides didn't move from your end. I think it could be a network issue or something. But I'll be okay to just share the presentation in the chat as we go through the demo. Otherwise, I want to take this opportunity to invite Marianne to start us off. Then Marianne, feel free to invite Rajab when your session is done. Otherwise, thanks and welcome, Marianne.
Thank you, Tieno. Kindly confirm you can hear me as I share my screen, and
Yes,
also confirm when my screen is visible.
Yes, it is visible.
All right, good afternoon. My name is Marianne Mwangi. I work for Palladium, and I will be taking us through the billing module navigational training. And we are going to use it in a way that we're going to look at all the users who interact and contribute to this module in terms of their roles and how they interact with the system. So to start us off, we have the role of the system admin, who is tasked to one, create users who will be interacting with this particular module. And apart from that, the admin will also configure specific billing module features, which we'll be going through. So for this, I'm using a test instance, and I have logged in as an admin. And the first task for the admin is to be able to determine who among the users in the facility will be involved in the billing module, what roles they will play, and what will be their responsibilities. So from the administration module, we're going to quickly create just 2 users. This is not going to be technical at all. One is going to have a cashier role. The other one is going to have a finance administrator role. So I'm quickly going to add my user. Their given name. The middle name. This is just looking at the demographic information of my user. The rest of the information ideally is supposed to auto-pick from the registry where we have the provider information. But for now, we're just going to fill just a few details. Then the login information. The username for my user is going to be Cashier B. Then I'm going to have a password for them. And if you want your user to change their login location, the next time they log in or to be able to set up their own password and username, you can check this.
Marianne, we are not able to see your screen. Maybe you can reshare.
Apologies for that. So I have filled the demographic information for my user. Hoping my screen is visible now. Songok, please confirm.
Yes, it is. Go ahead.
Then the login information. Then my user is not a provider. You really don't need to see patient information. Then next, we're going to assign them very few roles. UI privilege roles for them to see UI. Then the only billing role for this particular user is O3 cashier or accountant. And we're going to save and close. Then the next user we need to add is a finance administrator. Assuming that is their national ID. Then the name. Given name is finance. Middle name is, I want to call them admin. Family name is billing. And the username is going to be finance. Then again, they're also not necessarily a provider in the system. We give them UI roles so that they can be able to visualize that. And then the only billing role we will check is finance admin. And we save. So that's how a system administrator in a facility adds a specific users who will interact with the billing roles. They can add several cashiers depending on the number of different payment points that they have within a facility. They can add several administrators or people who interact with the billing role at a higher level and assign them the roles accordingly. Then from there, we're going to go through the other configuration settings that our system admin will be able to perform. And for this, I'm going to invite Rajab to continue. Rajab, kindly share your screen.
Yeah, thanks, Marianne. Let me share my screen. Confirm if you can see my screen.
Your screen is visible and you're also audible. Please proceed.
Thank you, Marianne. Allow me to log in. So, good afternoon, everyone, and thanks, Marianne. I'll be taking you through the configurable section of the billable services, or rather the billables. So I think my colleague Marianne has already taken you through how to create a user and how to assign the user the role so that they can be able to see the billable bit. So in my next section, I think I should be able to take you through on the configurable items that are done for you to be able to continue with the billables. So allow me to navigate to the billing module, which is on your left navigation panel. So once you click on your left navigation panel, some of the things that you should be able to see, one of it is the overview, exemptions, charge items, bill manager, payment modes, payment points, and payment history. So in terms of configuration, I'll dive in directly to the payment modes and payment points so that you can be able to see how to configure that. So allow me to click on payment points. We start there. So under payment points, so confirm if my screen is visible or if I need to in your facility if you have multiple payment points. So what you need to do is you just need to come here, create a payment point, give your payment point a name. For example, I can say laboratory. Just call it lab, and then give it a description. Then after that, so I can say lab cash point. Once I give it a name and a description, then I should be able to create my pay point, and you can see it has created. So if you have multiple payment points, so practically that is how you go about configuring the payment points. And then the next item I'd like to look into is the payment modes. So allow me to click on the payment modes. So under payment modes, we also have different categories of payment mode. For example, for some facilities, they might be able to use cash. For some facilities, they'll prefer to use insurance, others M-Pesa. So these are some of the payment points, rather payment methods that we have. So if you want to add a new payment point that you have in your facility and you don't see it on the list, again, we have this blue icon here on your right, which is termed add payment mode. So once you click on it, you should be able to also add your payment mode and be able to use that in your facility. So basically, another item that I'd want to just point out is this feature here for enabling the payment mode, which you can switch it on or off. So for example, for some facilities, currently we have this cash, and maybe a directive comes in that you need to disable cash as a form of payment. So you can just come on your cash payment method, scroll to your most left, you'll see the three dots once you click on them, you'll get the edit button, and once you click on edit, you should be able to turn off that particular payment point and save and close. So this will disable cash from the methods of payment. Next, maybe I'll just touch a little bit on exemptions. So under exemptions, so practically this is where we configure those services. I don't know if my view is okay. Yeah, better now. So under exemptions, so once you click on the billing module, then we have the tab exemptions there. So with these exemptions category, practically, basically what we're doing here is listing the services that are exempted, maybe for example, for some particular clients. So for example, I can just click on the view so that we can just see what we have. So under all, so basically, if you configure anything under all, it means all the clients who work in at the facility will be exempted for these particular services, the ones that will be configured or rather added under all, under the all tab. Then we have the program. So we have some particular services that are usually exempted depending on the program. So for example, for the HIV patients, maybe you might find out that there are some services that they are not supposed to pay, so they should receive them for free. Again, under TB, under the TB program, again, you see you have some services. And then for some facilities, rather most of the facilities, majority, we have some services which are free for the under 5 age category, which again, you should be able to add them here and just list some of the services, or rather commodities that are not supposed to be billed for this particular category. And then we also have the visit attribute, which, for example, you can just add maybe the prisoners whom are also exempted for some of the services. And lastly, we have the commodities section, which again, you can add those particular commodities that you feel like are free the facility and they're not supposed to be paid for. So allow me to click on the next tab, which is edit schema. I know this will be a little bit a deep dive, but we can, it's just a slight overview. We can engage further on how to do this on a one-on-one basis. So for example, under all services, so you can see this is where you list services that will be exempted for the patients. And for the guys, you know, there are IT techies at the facility, the HMIS persons who might assist with this. So practically, this is where you can come, add, for example, your program, your service, depending on the category that you want exempted by the facility. Once you've updated this particular file, you will proceed and just click on Save Exemption Schema for them to be updated. So once you're done with that, they should be able to find their way on this preview panel, and your users should be able to exempt these particular services to the clients or patients. Yeah. I'll usher it back to Marianne to proceed maybe with the charge items. Over to you, Marianne.
Thank you, Rajab. Kindly and share your screen. So again, confirm my screen is visible from your end.
Yes, it is, Marianne. You may need to just zoom it a bit.
All right, so we can proceed. The other configuration setting that is tabbed to the administrator or the system admin is creating charge items. So what are charge items? These are specific services or commodities that will be offered to patients coming into our facility, and we have attached a price for them. So for example, from this view, we're able to see a list of all charge items, looking at the name, the short name for that charge item, its status, whether it is enabled or disabled, and we'll be able to actually see what this is. Then the type of charge item, where is it attached to which service within the facility, and what prices have we set for this particular service or commodity, dependent again on how we have been able to set up our payment modes within a facility. So, for example, we may want to set up a charge item for maybe a drug. Remember, a drug is an item. So we will be able to do that under Actions tab from the drop down, Add Charge Item. When you're doing it one at a time, search for the commodity. For example, maybe I'm searching for a drug called amoxicillin, this particular drug here. Then for the status of this drug, for this particular charge item, when the status is on, it means you have enabled that status. That means if we have this particular drug in our stock and we attach now the price to this particular drug, the system will create a bill for this particular drug. But if we turn it off, it means we are disabling this particular charge item, either because we do not have it currently in stock, or we actually do not even offer it in our facility. So if the status is on, then we can proceed to add payment modes. We can set now the prices for the different payment modes that we had. We may decide this particular drug, we're going to sell it in form of tablets, and each tablet or capsule is going to cost 8 shillings when a client is paying via M-Pesa. You can also add another payment mode. We have insurance. Maybe for insurance, we're going to charge 12 shillings for the same tablet. And you can add as many payment, you can add prices for the different payment modes that you have set within your facility, and we can save. So that allows us to be able to add charge items one at a time. For example, maybe you may want to add a commodity that is not primarily a pharmaceutical product, something maybe like cotton wool within the facility. Let's just select this one, bandage, cotton wool. And again, enabling this, the status, turning it on and off is going to enable or disable it. Still, we can add payment methods, set a price for it. Maybe patients paying via mobile money, they will be charged how much? Maybe 400 for that bandage. If they will choose to pay by insurance, we can still say maybe for insurance, we're charging for the same bandage at 500, and we can be able to save and close. So this is for any item that is a commodity, a tangible commodity at the facility. It can be either a pharmaceutical product or a non-pharmaceutical product. Then when it comes to services, those particular services we offer either in terms of procedures, in terms of lab orders, in terms of image orders and the likes, nursing charges, doctor's fees, we can be able to add them as services. So again, we go to the Actions tab. From the drop-down menu, we select Add Charge Service, and we can be able to add the service, the item, the particular charge for that particular service. This one is slightly different because you need to attach the exact service concept within the database. So for you to do that, even before you give it the service name or even the short name, it is always prudent to come and search for that particular service so that you can be able to get the exact concept that is attached to it. So for example, maybe we want to attach a nursing fee as a service. We can still use the same name as our service name. Short name, we can call it NF. Then for this particular service name, nursing fee, where are we attaching this particular service? So mostly you will find most of this nursing fee will apply maybe in most of these areas, but for now we can just select clinical consultation. Then again, we need to enable this particular service by turning on and off this particular status. And now we can proceed to adding the exact amount we want to charge for our particular service, which is nursing fee. So again, if a patient is paying by insurance, we may want to charge our nursing fee at 2,500. M-Pesa or patients who are paying via mobile money, we can set it at 2,000. And we can be able to save and close. And we can set as many prices for the different payment modes that we have in the facility. We may add one more service. For example, we may want to add a lab service. Again, remember, search from the concept, the service concept. We may want to add an X-ray. Preferably maybe a leg X-ray. Again, just copy the concept name. This one, it's not a must for you to have the concept name matching the service name. So even here, I can just come and say leg X-ray. Short name, let me just use the same. And the service type that we are attaching this particular service should be an imaging service. Sorry, radiology should do. So we'll attach this particular service to the radiology department. Again, ensure the status is on so that it is enabled. Then we can proceed to add the different payment modes. Attaching to insurance amount, we can set this to around maybe 3,000. Mobile money, we can say maybe we are charging 1,800 for the same. And we can save. So you will be able to create as many charge items as you have within your facility. Any service that you actually charge for from the time a patient walks in. If you're charging for registration, for consultation, you can be able to put all that as either a service charge or a charge item. Again, we also have this functionality whereby you can be able to download a particular template. It is a CSV file. And this particular template will allow you to manually input all the charge items you have in a facility, but conforming now to the format of this particular CSV file, whereby you will be expected to give the exact concept ID, the name, the short name, the price that you have set for that particular either service or commodity, and then whether it is enabled or disabled, yes or no, and the service type ID. But again, this should only be done by either a system administrator who will be able to get the concept ID and the service type ID from the database itself. And this is something that can be taught in an administrative training. Then once you're done with that particular CSV file, then you can be able to do a bulk upload. But you have to be very careful with whatever information that you're using, you're putting inside that particular template. But again, depending on the size of the facility, the decision can be made either to add the charge items one by one, starting with either all the services, then go to all the commodities that are on offer, set the prices. Also have different people performing this exercise. The system allows you to do both, either as a bulk upload or one particular item at a time. Then again, it is also advisable. Over time, you may find that you will have a lot of charge items that you have created in terms of services and particular commodities. So when you're trying to add something new, it is always recommended that you search. For example, maybe we may want to set up for consultation. So it is always good to either search. If one thing changes, either the price for that particular service has changed, the system now allows you to come. At the far right end, where we have the 3 dots, there are some options there. You can be able to edit the charge item. So editing the charge item now allows you to either disable this particular charge item by turning it off, or remove either of the payment modes by deleting them if they're no longer applicable in that facility, or you can also be able to edit the price. For example, maybe you are charging 1,000. You are charging 1,000 for consultation, but after some time it has been reviewed up, and now you're charging 1,200 for consultation. You will be able to just come and edit and save and close, and you'll find that your changes will be included now here. So again, so that we avoid a lot of duplications, this page is yet to be validated. Before you add a charge item, it is advised that you search for it. So basically, that is how we add charge items. This is something that the teams can practice, and they can consult if we get to encounter any challenges. Then once now we have set up, we have determined who our users are going to be for this particular module. We have determined what are our payment modes. We have agreed that we're going to use insurance and M-Pesa, and we have different payment points in our facility. That means we have determined what cash points, or what are the billing points in our facility. We have added for lab, we have an OPD cash point, and we can be able to add as many as possible. Now we can go to the functionality of how to add or create a bill so that we can proceed with the other billing module functionalities. So how do we add a bill or create a bill within KenyaEMR? So there are three ways of doing that. The first way is when other users interact with the system and they are able to create a bill, all the way from registration. When we are checking in patients, the registration clerk can be able to create a bill depending on the first service our patient will be given, and charge them or bill them for that particular service. So the other way is when somebody like a clinician who is seeing the patients orders for particular services, and these particular services are attached to a price, and they will create a bill on the background. The other way is when patients may be being offered different services in the facility, for example, procedures by the nursing department, and there are commodities and products that are being used by these facility users that are chargeable to the patient, such as cotton wools, gloves, syringes, and the rest. And we can be able to add them as singular items from the patient homepage. So we're going to look at how to do all three, starting with the registration desk, whereby we're going to get a scenario of our patient who is coming into the facility. I'm going to search for an existing patient. I'm going to call my patient billing. I'm interested with billing training today, who is my patient, who has come into this facility, screaming in pain because maybe they fell down and they have, they may suspect to have a fracture. So they start with the registration desk. At the registration desk, the system, you cannot be able to do anything with the system without starting a service. So this is the point whereby the registration clerks interact with the system, and they will start a service for the patient who has come in at the facility. So this particular form helps us to, one, determine if the patient has any upcoming appointments, to determine what is their visit type for today, what are they coming to the facility for, maybe they're coming for patient services. Then two, interact with the patient and find out how are they going to pay for the services that they will get in our facility. So again, this is the point where we determine whether our patient is a paying client or they're not a paying client. That means the system is going to ask, is patient exempted from payment? If patient is exempted from payment and we say yes, remember the exemption criteria or categories that Rajab has showed us how to add depending on a facility. We can have, maybe we're exempting prisoners from paying in our facility under files, patients who are in the CCC, refugees, patients who are above 60 years, remandees, street kids, and the like. So if our patient falls on this criteria, then we're going to select that, and no bill will be created in the system for this particular patient. But if our patient is not exempted from payment, then we will say no, and the system will ask, what payment method will our patient be using to pay for the services? So again, remember, we had only configured two payment modes, insurance and M-Pesa, being that in this particular facility, we only use insurance and M-Pesa to process payments for our patients. So maybe our patient may say they're going to pay via M-Pesa, and you will be allowed to proceed with the next service that you want to bill our patient. But if our patient chooses to pay via insurance, the system will further ask what particular insurance scheme the patient is using. Again, this is configurable in the system. We have all the insurances added, and you can be able to add the missing ones. This is also an administrative task, and we can be able to select accordingly. So maybe, for example, our patient may choose to pay from SHA, but remember again, we have an integration with the HIE or the SHA registry, whereby the system will even be able to determine whether our patient has been registered to SHA. So if it finds that our patient does not have a SHA number from the registration information we have from our patient, the system is going to give a warning that patient is missing SHA number. SHA validation cannot be done from the registry to determine whether our patient is actively submitting remittances so that they can use the insurance, and the system will advise you to transition the patient to the registration desk to be able to register to SHA. And we can now proceed to either update their registration if they have a SHA number. If our patient may choose any other insurance, for example, let us choose Jubilee Insurance, the system is going to proceed to ask for the policy number, and I'm just going to choose this one as a policy number for our patient. So that means our patient is going to pay by insurance, via Jubilee Insurance. Then at this point, what services can we even bill our patient at this when we are starting a visit? We can say the first, we may bill them for consultation. We actually bill our patients for consultation, and then we can transition them to the exact place where they should go to receive consultation services, either the OPD or the CCC or the MCH. If we have configured the queue services very well in our system, we will be able to place them again in a queue and also determine the patient priority. Allow me not to do that because my first instance has an error there. Then even from this point, I can be able to check in my patient. So you will note my patient is an outpatient patient. They are not exempted from payment. They're using insurance method to pay. They're using Jubilee Insurance, and that is their policy number. And the first service that is a chargeable service in our facility is a clinical consultation, and we can be able to check them in. So two things will happen. A patient bill will be successfully created for clinical consultation, and the system will also automatically start a visit for our patient. So that is how you create a bill number one in KenyaEMR, even right from the registration desk. So ideally, that is somebody who should have logged in as a registration clerk. Then transition the patient to the clinical rooms or to the queue service where the clinician now will pick them from their particular queue. So when they go to see the clinician, after seeing the patient through the clinical consultation and the different management forms and tools, a clinician may decide to do some lab orders. Remember, they may decide to do some orders so that now these particular orders and services are particular chargeable items that we have attached among our chargeable items that a patient will pay for. So allow me to add a few orders so that we see how this creates a bill in the system. So for example, maybe we said our patient has come screaming with pain. So the clinician may want to do a drug order for a drug. I'm going to do this very quickly. So maybe they may want to order for paracetamol, 500 milligrams. Sorry, 1 minute. Allow me to switch users so that we can see some of those functionalities. So again, I'm going to search for my patient whose visit we have just started. Proceed to create some orders for them very fast. First order I want to make is paracetamol. Our clinician can be able to see that it is actually in stock and be able to see how much of it is in stock depending on the different stock stores, stock locations that they can be able to view. And this is something we were able to look at during the last training. They can also be able to see how much we are charging for these particular drugs via the different payment modes that we have set. So we're going to go quickly and give our patients, create an order for this drug. And you can say maybe they're expected to take it twice a day. We want them to take the drug for 10 days. So that means twice a day for 10 days, that is 20 tablets to dispense. The indication is for pain, and we can save that particular order. Then a clinician may also want to order another drug. We are just going to order this amoxil that we created as a charge item. A minute, I look for it. So again, there's visibility of what is in stock by the clinician. Again, this is also a tablet. Forgive me if it's not a tablet. We can give this on our patient once a day. I don't know how they're given. Once daily. Maybe for this particular antibiotic, we want them to take for 5 days. So that means we are dispensing 5 once daily. So that means 5 tablets. Then the indication for this, I'm just going to write infection. Then we save. At the same time, remember our patient came screaming with pain, and the clinician may want to do an imaging order, request an imaging order. And they are claiming that they have excruciating pain in their legs. So we may want to do a leg x-ray. So again, quickly create an order for that immediately. Maybe they are complaining on their left leg. Order reason, suspected fracture. And we can save that. Then we are going to assume here, because we are not going to do any of this, we are not going to fulfill the lab orders or the imaging orders. We can assume the clinician actually knows our patient has a fracture, and they can also request for casting as a procedure. So casting application is a service. It also has an attached price. Again, we want it done immediately. 0 repeats, frequency is no order reason is we can say fracture. Then we can save the order. So that means our clinicians has been able to do two drug orders for a patient, 1 imaging order, 1 procedure order, and we can even maybe add a lab order just to go with that. We can order a complete blood count. And we can save. So that means we have around 5 orders for our patients that have attached prices within the system. So the system has managed to place all the orders successfully. And that means now we can transition our patients to the different departments to receive care. But remember, for each of these services and commodities they have been given, they may need to pay first. So that is the second way that we create a bill, by raising an order in the system. So for all the orders that you have created, the lab order, the pharmacy order, they have been managed to raise bills for the drugs that we have given. Same case with the procedure, imaging, and lab orders, and we'll be able to see them when we go to the billing overview, where now the patient is going to make payments. The other way of creating, or the third way of creating a bill in the system, is from the patient homepage. On the far left, where we have the patient sub modules, under billing, we can be able to add ad hoc or bills that we are getting as we manage our patients. For example, when we send our patient for procedures, for casting, maybe the nurse, they may want to charge for their nursing fee. So we are going to add, let me just go back. From the patient billing submodule, we can be able to add a bill item. So I'm going to click on that to add. So the first thing we may want to do here is to add for nursing fee or nursing charges. Maybe they have just received one session with the nurse, so we're going to choose they're going to pay by insurance. And the insurance amount we had set for nursing fee as a chargeable service was 2,500, and that is what our patient is going to be charged. At the same time, this particular nurse may have used some cotton wool. Maybe they used several of them. So again, for the quantity, this is variable. You can be able to adjust up and down, or you can just be able to type. Maybe they used around 6 cotton wools. Then we choose a payment method, again, insurance. So we are going to attach the price, multiply it by the number of quantity for us to be able to get the total amount. So for the cotton wool that was used by the nurses, we're going to get a total amount of 3,000 because there were 6 of them and each is 500. We may want to add maybe something else like a bandage that was used during that procedure. We just select this one, and you can say maybe there were 3 of them. Choose the payment method again, and then again the price will be calculated dependent on the quantity multiplied by the item price. Then we can save and close. So that means we have also been able to add particular services and commodities that our patient was able to use during the journey of their care within this particular facility. And you can be able even to see now their total bill is amounting to 15,150. Now, for the patient bill, let me also add that you can be able to add a deposit. If, for example, the clinician was to admit this particular patient and the admission fee in that facility is maybe pegged at 100,000, there's an option of being able to add a partial deposit that will deduct to the final amount. And this is something that will be done so that we can be able to select the exact billable service, the payment mode that our patient is going to use, and amount to be deposited if they're not able to make a full payment, depending on what we are charging them for a particular service or item. That this is just by the way to explain what this particular tab is for here. Then when we are done now with this, we can transition our patient to the billing clerk so that they can be able to pay. So remember, we created 2 users. One of them was a cashier, so I'm going to transition to that particular user. I'm going to log out. I had logged in as somebody who can be able to perform more tasks in the system. Our user was called Cashier B. We're going to log in them into the facility. And remember, for the cashier, their main interest is they will be interacting with this particular billing module. Now, depending on the validations that will be attached between the user credentials and the roles in the facility, they may not be able to see all this, and the view may be different even at site level because a user is only allowed to see what they're interacting with in the system. So for our case, our cashier is interacting with the billing module so that now she can be able to process the payments for particular patients. So from the billing module, we're going to access overview. So from the overview, this is now like the home page or the dashboard for the cashiers. One, they will be allowed to clock in. The system allows clocking in and clocking out. So we're going to clock in. Allow me to refresh this. So they can be able to clock in, and by clocking in, the system will allow them to choose the exact payment points that they are stationed. It can either be a billing point, either the OPD billing, lab billing, pharmacy billing, depending on where they are at the facility. So that functionality works, but allow me not to go there. We may encounter an error. So our cashier will be able to see just a brief snapshot of the dashboard, the total accumulated bills as at today. Today's paid bills out of the total accumulated, total pending bills, and any exemptions in terms of aggregates, if there are any. Then they can also be able to drill down to a particular patient bill. For example, we can try and look for our patient here, and we can be able to see our patient visible, and they can be able to select them. So even from the today's bill, again, they can be able to navigate from this particular view. They can be able to filter by searching for the patient's name, and they will be able to narrow down to that particular patient who has come to their window, who wants to pay for the services they have incurred. At the same time, they can also be able to filter so that they can see exactly what is either pending bills, because that is their interest to process payments. As well, they can also be able to view all bills that have been paid and any bills that have been posted that are awaiting either authorization from insurance and the likes. So again, if I select by pending bills, I'll also still find my patient from among them. And they will be able to see now the time the patient, that particular bill was created, the patient in terms of their name, their identifier, a snapshot of some of the items that they expect to bill them, and the status for this particular patient. That means all of them are pending. They have not paid for anything. So the patient name. So once our cashier manages to log in, clock into the particular payment point or billing point in the facility, and they search for the patient who has come to their window, the system will navigate them to this page, which is the patient, that particular patient's payment page. They'll be able to see the patient name, some few details about our patient. They will also be able to see they're paying by insurance, what insurance scheme, and the policy number. They will also be able to see the total amount that is due for our patient. The invoice number will be automatically generated by the system, the date this was done, and the invoice status as pending. So at this particular point, the cashier can process the payment if our patient is ready to pay, or they can first of all print the invoice for our patient, so they can have a look at what they are being billed for in terms of who the patient is, from where they're coming from. Some bit of the patient details will be. Is my screen visible for the invoice?
Yes, it is.
The print view. Okay.
Yeah, but
then
just zoom in a bit. Just zoom in a bit.
I don't know what is zooming, whether it is the print view or
it's the screen. It's not the print view that is zoomed, that is being zoomed.
Yeah.
It's
unfortunately,
it's okay. Just proceed.
Yeah. We just can proceed this way. So this is what they will be able to see for the patient. Print out this for the patient, showing the inventory items, the quantities, the price per item, and the total bill, and what is due for the patient. They can also choose to print this for a patient. This happens in some cases where the patient is not the one who is paying, and they may want to show the person who is paying for these services, or take them for processing further. But if our patient is ready, that means now the cashier can go ahead and process the payment. So KenyaEMR allows the cashier to be able to process payment in terms of either checking the different items that our client is ready to pay for. Again, our patient may not be ready to pay for everything, or they may not have the total amount, so they can just check what the patient is ready to pay for so that they can start receiving those services as they look for money to pay for the others. So once that happens, we check that. That means they will be able to process payment for these particular services, calculate for the checked service, how much our patient is willing to pay for. Or our patient may be willing to pay for all the services, check all the items, and be ready to process the entire 15,150. So the cashier can be able to process this again in two ways. One, the manual process, where they can come under payments, select the payment method, add a payment option, select the payment method. Maybe our patient is willing to pay via mobile money. Enter the amount they have for mobile money. Maybe it's the entire 15,150. Input the M-Pesa reference number for that transaction that our patient has paid with, and proceed to process that particular payment. Else, our patient may choose to pay via insurance. Maybe insurance is only willing to pay for some of the services. So maybe there are some services that the insurance is not willing to pay for, or they are not approved to pay. They have not approved. For example, they may not approve for the X-ray, for the casting. So that means we need to deduct 3,500 from this equation, so that now the insurance is only going to pay for 12,150, and we can proceed to process that particular payment, and we'll still have a balance of 3,000. If, for example, our patient is paying via mobile money, whereby we may select M-Pesa, again, the user or the cashier can choose to either process that payment manually or process it via STK M-Pesa push from the M-Pesa payment option at the top here. Well, they will just need to enter the patient phone number. Then the total bill amount will appear, what we want to bill our patient for. Then they can initiate the payment. So a facility needs to be configured for this to happen. That is integrating now the Safaricom M-Pesa API with the particular facility pay bill or till number, so that whenever a patient now, that particular SDK push is going to use the patient number to project the amount to the patient phone, and all the patient is going to do is just to input their bill, their password for M-Pesa, and that payments will be processed automatically. So this is configurable, and there are some requirements for this that you can reach out to the particular HIS or HMIS team that support your facility or your county, and this can be integrated. And this is an integration that does not happen at the facility. So if you want your facility integrated to be able to use this functionality for M-Pesa SDK push, this is something that can be done. So let's proceed to processing this particular bill. We are going to select all items. And for our patient, remember, they were paying via insurance. And the insurance is going to pay for everything. So we're going to put 15,150 so that now we can proceed to process the entire payment. But the system is flexible enough to, one, allow a user to pay for services that they're ready for, in terms of checking now which particular items are of priority and interest, and match what the particular patient has in terms of cash. Two, you can be able to process the payment manually, like I'm doing, or the system also allows to be able to add different payment methods. For example, insurance may be just paying for 12,150 as a cap, but we still have a balance of 3,000, and the patient can choose to pay that 3,000 using M-Pesa. So we can charge them via M-Pesa for 3,000, either via STK push, or they pay manually, and we're able to put the M-Pesa reference number, and we can be able now to process the entire payment. So the feature, this particular feature for billing is quite flexible and it can work with any scenario in a facility setup. So I'll just go ahead and process my payment now. So when that happens, you get a successful message from the system saying that the bill has been processed, and the cashier now will not be able to proceed to add any other payment method, and the amount due is going to change from 15,150 to 0 Kenya shillings. So what the cashier can be able to do at this point is either, because our patient has been able to process their payment via insurance, is to either choose to end this particular visit if the patient has already received all the services, and choose to proceed to process claims so that now they can be able to claim this amount from the insurance. 2, if our patient has paid for the entire amount, they can choose to print a receipt for them that shows now. Let me just adjust this view a bit. That shows now some details on the facility name at the top, the date, the receipt number, the patient, the specific patient ID, line items that have been billed for, the total amount that our patient has paid, and even how our patient has paid. And for the M-Pesa transaction, the reference number will also be included here. And down at the top of the receipt, we will have the name of the person who has processed that particular transaction, and this can be printed to our patient. So that is how we are able to process a particular payment for our patient within the system. Now, kindly let us transition very quickly to how to process now the e-claims. For this, I'm going to invite Rajab. Then we are going to end the session by looking at what outputs do we get from the billing module. Rajab?
Yeah, thanks, Marianne. Allow me to share my screen. Marianne, confirm if you can see my screen.
Rajab, you can proceed. Your screen is visible.
Okay, thank you. Yeah, so I think we can. I think I'll start with the clock out, which I think there's someone who asked about the clock out, clock in. Maybe just to showcase this before I proceed, is just that this clock in and clock out feature practically or ideally works in facilities that, for example, we have cashiers who work in shifts. And so, for example, I come in the morning and I clock in. So when the shift changes, I need to clock out. Or for example, when now I'm moving from one cashier point to the other one, I'll need to clock out of this cashier point and then go and clock into the other cashier point. The reason as to why we have this is that at the end of the day, when we are doing our daily consolidation in terms of the bills and payment generation, we can be able to also tell who or when was this particular cashier at this place, or rather who actually processed payments for this specific cashier point at a specific time. So basically enabled or rather in the system. Yeah, over. So thank you, Marianne. So I think I'll proceed now with the e-claims, and maybe just a disclaimer. We are using a training instance, so practically some of the things that we have configured here are not real or rather real time. So in an ideal facility, you will have the facility configured to the e-claim process. That is, we have tokens and we have authentications to enable this to work. And each and every facility has got this particular token associated to every facility. So maybe just to touch on each. So for the claims to work, we need three things here to be working. One, the facility to be configured to e-claim so that they can be able to have that bi-directional communication between the two. And then 2, we need to have also the clinicians, the nurses, or rather the MO, also verified under the e-claims feature that we have. And then 3, for the patient to be able to claim, to process a claim, the clinical encounter, or rather a green card, has to be documented so that we take note of the diagnosis for the patient. So remember, diagnosis is very key when doing any e-claim processing, so that you can be able to give rather the reason as to why this particular service was offered to the patient. Yeah, so as Marianne was demonstrating, I think she was able to make some payments in using M-Pesa, and also make some payments using insurance. So for those payments that were done using insurance, that is what you will be able to see in the claiming UI. So allow me to proceed and click on end visit and process claims. And I think Marianne had indicated as to why we have end visit here. So remember, for a claim process to work, we need to have closed that visit so that the system picks that, yeah, so for this particular visit, this is all the services that were offered for this patient. And now this is what we are supposed to claim from the insurance. So allow me to proceed and click on end visit. So once I click on this, basically it will automatically check out the patient, or rather end the visit, so that you can be able to see all the items that have been paid using the insurance. So so we have these items, so you can be able to select which one you want to make claims for. If there are those that are not approved for you to claim, you will leave them out and only check the ones that have been approved by the insurer, so that you can claim. So on the left panel is where you select the items that you want to raise claims for. And then and these other sections. So here we have the package. So remember, for those sites that will have been configured to use the claims feature, so we'll have this package loading from the directly from the insurance or the insurance provider. Whereby once you click on this drop down, you should be able to see the list of packages that are eligible for this particular patient, and also a list of all the interventions that are allowable for our patient. Then from there, remember, for diagnosis, you need to have documented clinical encounter, so that you document the diagnosis. So remember, this is very key when doing claims. So we should ensure that for all our patients, we document the clinical encounter form, so that we can be able to record the diagnosis there. So once you have the diagnosis, again, you should be able to proceed and give an explanation as to why we are doing this claim. And then finally, we also need to give the justification for making these claims. So once you document all these fields you document, so the process claims feature will be active. So I don't want to document all this, because once I click on process claims, it will push it to the claims end. And remember, this is a demo session. So ideally, that's how we do the claims, that is from the facility, for those sites that are currently activated to do claims. Yeah. So I think, Marianne, that will be it in terms of the claim feature, unless there is any question in this regard. Over.
Thank you, Rajab. Now we can proceed just to visualize briefly what outputs. Rajab, if you can unshare your screen.
Yeah.
From the billing module that we have gone through, remember we created 2 users. One was a cashier to help in processing the payments and processing the e-claims. And 2, we had also created a finance admin. And this finance admin that I'm currently logged in as may be interested now to see what outputs this particular module is giving. And we can be able to visualize this again in 3 ways. One is from the payment history under the billing module, payment history, so that we can be able to tell at a facility level, depending on how we have set up the different filters that are available, we can be able to get the transaction history of all the payment that have been done and the current status for them. And we can even be able to search for a particular transaction in terms of even a particular patient. So the system has allowed the user to be able to navigate this using a specific date range. We can be able to visualize this particular summary for a given day, for a week, for dependent on how they want to look at it, for a month, for 2 weeks, and so on, depending on the date range. Then they can also be able to do this by service type. We want to look at all payments that have been done coming in from the clinical consultation, from lab service, and so on. But if we want to visualize for all, then we can select for all services. Then we may also want to narrow this down per payment type. We may want to see how many transactions have we had within our facility, dependent on how we had set up our payment modes, maybe for M-Pesa, for insurance, or for waiver. Again, if we select all, it will give us a view of all the payments. Again, we may want to track down a particular transaction for a particular cashier. And this is why we are also attaching a cashier to a particular pay point. We may want to select either all cashiers, so that's going to give you a view for all of them, or we may want to look at a particular cashier for that. So that is going to give us a summary down here, showing now the particular date or the transactions that are contributing to different payments for these particular filters that we have applied. Showing the patient name identifier, the total amounts, what services they were billed for, any reference code if any mobile money was used, and the current status for each transaction. And this is also available as a downloadable list, as a CSV file that the users can be able to download for further analysis, to be able to provide further input or insights from this particular financial data. As well, we may also want to get payment mode summary in terms of the total collections that we're getting per payment mode. How much is M-Pesa? What is the proportion that M-Pesa is contributing, insurance is contributing, cash, waiver, donations, or any other payment mode that we have within our facility per the filters that we have applied by date, by service type, by payment mode, or even by cashier. So this is just a general view of the billing module. It is also under construction, and we're also receiving user inputs to be able to make it better. The other place where we can be able to receive financial reports is from a reports module, specifically from MOH 717 under EHR reports. This report that can be again generated dependent on a date range, either a day report, a week report, a monthly report, depending on how a user wants to visualize this particular report. You can choose to view, download as a CSV or as an Excel, and you'll be able to visualize this. See. So it will open for you the MOH 717 workload template, and we can navigate to the second tab where we have, the third tab, where we have the finance section, section G, that now will give a snapshot of the total amount collected at the facility in terms of what has been received for a given period of time, how many clients were waived, how many were exempted, what was the total amount that was waived and total exempted. Again,
is not visible.
Oh, sorry.
You have to reshare your screen.
Oh, yeah. Sorry for that. So from MOH 717, I'm hoping now it's visible from your end.
Yes, it is.
So from the third tab, that is where we have, yes?
I'm saying just zoom slightly so that.
Okay. So this is where we have the finance data. From the third tab, section G, and we can be able to see some statistics on some collections, aggregate collections from the billing module, dependent on how we have filtered for the time period, total amount collected, total amount that has been received from the collections, clients that have been waived, and the amount that has been waived from those clients, total exempted, and what has particularly been exempted. Then as well, this may not be informative so much, and maybe the billing team at the facility may want to visualize more financial reports and be able to analyze their data more. We have the functionality of navigating to the specific facility dashboards. So from the homepage, again, we are going to access KenyaEMR modules, then go to facility dashboard module. And this particular dashboard, this particular page allows us to be able to see two dashboards, one, the surveillance dashboard and the above site dashboard. So of interest is the above site dashboard that is going to allow us to view from Superset. Again, we need specific credentials for this above site inventory. And credentials dependent on the users who will be using this can be again availed through the HMIS and the HIS teams that support you, because we may need to localize it. So once you are able to access the facility dashboard, this is the view that it will give you. You can be able to tell from the facility dashboard, from the total workload that you had. Again, this can be for a specific time period. It can also be it's actually for that particular facility. What are your total collections for this particular time filter that you have applied for the total workload that you had for that time? Then you have a specific tab dedicated to financial data. Again, we are open to suggestions on how to improve this view, where you're able to visualize now the total collections by payment modes. Remember the payment modes we're able to create. So you can be able to tell for a specific period of time, dependent on the amount that we're able to collect, what was the proportion that we got from exemptions, maybe from SHIF, from invoices, from SHA, from MAVA, from insurance, from mobile money. And this will be displayed as a histogram. Then we can also be able to tell a trend by month, what has been the total contribution in terms of total collections by month. We can be able to see how we are faring each month. Again, total collections by week, and we can be able to see a graph for that. The good thing is that these dashboards can be customized dependent on how a facility would want to view them. And this will now primarily be used by the facility administrators, by the HRIOs, and by the finance and the records team at the facility. So that is what we have as outputs from the billing module. And that concludes our demo for today. Back to you, Songok.
Thank you. Thank you very much, team. Of course, starting with Otieno, who took us through the slide deck, covering much on the introduction of the billing module in KenyaEMR, the features within the module, and you're also able to talk about the benefits. I think at this point it's good to note that billing is a very important functionality, especially when it comes to the implementation of facility-wide EMR, because the expectation is that payments would be coming in from all or most of the service delivery points within the facility. It's also important for us to appreciate some of those key features that he talked about, and of course the inclusion of the various modules that he mentioned, and I think Marianne and Rajab have been able to ably take us through. So at this point, I want us to open it up for any questions. I know the team was available to respond to most of the questions that you had, and I think I was able to quickly just run through the chat to see whether there are any questions that are pending. Most of them have been responded to. I think the question that was raised by the team from Matoso regarding collateral payments, like for instance, if a patient probably has been discharged or received a service and probably they don't have the money at that time, and maybe they want to deposit maybe a logbook or something of that kind. I think that's if I got it right, I think the question was asked in relation to that. So my thinking is that, of course, the payments will remain pending because the payment hasn't been settled. I don't know whether there are any instances where one would probably hand over an item in form of payment. I really don't know how that would be computed, but maybe the team can be able to respond. But I think in situations where probably you've deposited maybe a logbook or a land title to old brief, so to say, till the time when you get the money. So the payment will remain pending, but once the payment has been settled, then that will be processed. But I would allow the team to just speak about that. I think there was a question about STKs, the push for STK. I think that was also responded to, but I would want to maybe allow Ogutu to just make a comment on that, because I think that's a very important question that was raised. Maybe Ogutu, I'll give you an opportunity to just voice it. Yes, I think the rest, there was a question about the summary, which I think Marianne has covered it very ably, because I think that's very important. At the end of the day, you would want to know the payments that were made, where how much is coming in as cash, how much is coming in through M-Pesa. I mean, because at the end of the day, you need to balance your books and probably just take account of all the payments that have been made from each of the service delivery points or each payment points within the facility, because in some instances there are more than one, just to ease congestion and of course to speed up the process. I don't know whether there is any question that has not been responded to. I've quickly run through and I'm seeing most of them were responded to. I don't know if you have any question that probably hasn't been responded. We still have about 7 minutes. We can take 2, 3, or 4 minutes to respond to any questions that probably you'd want to raise verbally. Of course, the team is still available to interact with you through the toll-free line. Thanks, Ogutu, for posting and the toll-free line. It's available on chat. So you can always reach out to the team. They'll be able to remotely support you. You can also send a mail in instances where you're not able to call, and the team will always be available to respond to your concerns and provide the necessary support. All right, so I'm not seeing any hand up. Let's see. I'm not seeing any hand up. Oh, yes, so I can see a hand from Brenda. So maybe Ogutu, you can allow Brenda to speak, and then yes, there's a hand also from the team in Matoso Health Center. You can also allow them. So we can start with Brenda. Brenda, go ahead.
Good evening. I was asking if the facility dashboard for collection can be displayed in terms of departmental collection, like lab collected how much in this month, records, pharmacy, to enable the administration do budgeting.
Okay, thank you. Yeah, I think that's also very important. Matoso, your hand was up. You can go ahead. Or it was related to what Brenda has asked, because I can see you put down your hand.
Yes, it was related. It was related to what Brenda said.
All right, thank you. Thank you. All right, so maybe Ogutu, you can probably go first. You can comment about the STK. Then I don't know whether it's Rajab or Marianne. You can also comment about the issues around payment using collateral payments, probably using a logbook or any other. And then you can also respond, Marianne, I guess you can also respond on the facility dashboard, whether we can be able to visualize in terms of the departments. I know it's very key, and especially when it comes to budgeting at the facility level, when they are allocating funds, sometimes they have to look at how much did you generate for the HMT at the facility to also allocate that money back to you in terms of revolving fund. Yes. Who will start? Ogutu, you can go first.
Okay, good afternoon, everyone. On the EMR STK push, it's not something that is enabled or you can configure from the EMR side due to the sensitivity of
money issues. So for that, if in case you want the service configured, you can reach out to us, provide some of the details from the provider, that is Safaricom. I think I posted some 5 key requirements to help us do the configuration. That is the business shortcode, consumer key, consumer secret, M-Pesa API passkey, and either till number and paybill number. So we should be able to help you do the integration for the service for your facility. So this one is per facility, and you can always reach out to us in case you want it configured. Thank you.
Thank you, Ogutu. Thanks. I felt like it is important for you to just verbalize that process. Marianne or Rajab, maybe you can take up the remaining questions.
Okay, I can answer some, then Rajab can take up the rest. So for facility dashboards to display in terms of department collections, this is a good request. We can either add the departments as a filter. So again, within the departments, you can be able to visualize in terms of payment modes, what was generated, the amounts generated per department, or we can add it as one of the visualization graphs. So we'll figure a way of enabling this in the system. Thank you for that feedback. Then for collateral payments, I'm assuming this is where a patient is able to give up maybe collateral in terms of maybe a title deed or a logbook for a vehicle as an intention to pay, so that they can either receive a service or for a patient maybe to get admitted or for a surgery service to be given in advance. So we may want to get in touch so that one, we understand how that workflow is done at the facility. What are the current scenarios? How is that documented? How is that translated to cash? How is it monetized? So that either we can integrate it through the waiver workflow or the deposit feature that we currently have in the system. So we're going to get in touch so that we can understand that more. Rajab, you can take up the rest of the questions.
Thanks, Marianne, but sorry. I think they were I think those were the only questions that were raised from Brenda and Matoso, and I think it has been well covered. So over to you, Songok.
Yes, I agree, Rajab. Actually, those were the two questions that were raised. I don't know that there's any other. I can see there's an Anne from Banpieri. I hope I got that correct. Ogutu, probably you can allow our colleagues from Banpieri to ask their question.
Yes, they can unmute and ask the question.
Okay. Banpieri, you can go ahead. You can unmute and speak. Okay, probably they're having a challenge in unmuting. Are you able to unmute from your end, Ogutu?
I have given them the mic. They just unmute and then they talk. I've enabled the mic.
Okay. Probably they're having challenges. What I would suggest is that you can also post your question on Q&A. The team will still be able to respond, and the world will still be available for you, so you can always be able to just quickly check through. So let's have one last one from Maurice. Maurice, you can go ahead. Or go to just give him the mic.
Who?
Maurice.
Maurice.
Yeah, his hand is up.
Maurice, yes, Maurice, you have the mic, you can unmute. Maurice, you can unmute.
Hi, good evening.
Good evening to you, Maurice. Go ahead.
My question goes to Marianne on waiving clients in the system. The last time I checked, when waiving a client, you are supposed to have someone else to approve the waiver. I don't know where it has reached. Thank you.
Marianne, quickly.
Yes, yes, Maurice, I was actually responding to that question on the chat. This feature is still under review because we needed to gather some more requirements on the actual functionality at the facility. There are different scenarios in different facilities where one, the waiver, the person who needs to be waived either needs to go see a social worker, they discuss all that process is what we are actually now reviewing in the system so that we can get that process functionality, the authorization, different authorization levels. But still currently, what we can be able to do is we can still be able to waive for the full amount or partial amount and still document a reason for the waiver. But we are still coming up with a better feature for that particular process.
Thank you. Thank you, Maria. Yeah, I agree with you. Processes within the facilities, I mean, in facilities varies depending on the level because there is like an assessment has to be done to just establish and confirm that the patient or the client actually is eligible for a waiver. Then someone raises the waiver, and in most hospitals, then the administrator would be the final person to approve the waiver. In some instances, it could be the METS, but it varies from one facility to the other. So probably I think it would be good to just understand, just like you mentioned, to understand the processes, and then probably you could then be able to conceptualize how best can you capture that within the system, because for sure it varies from one facility to the other. So I think up to this point, we've come to the end of our second virtual training. I want to take this opportunity to appreciate all of us for finding time to attend this training. I think it was very, very, very interactive, and we are hoping that the coming sessions will also be interactive. Our next session will be coming up next week. Yes, our next session will be coming up next week, and next week our main focus will be, I need to just confirm this, just give me a second. I need to just check. Sorry. Yes, sorry for that delay. So next week we'll be focusing majorly, we'll be talking about our training session will be focused on lab workflow. Thanks, Otieno. Lab workflow and VL remote login. The areas of focus will be lab order process, the procedures and radiology orders, and also we'll be able to finally talk about the lab workflow. That will be next week on 17th from 2 to 4 p.m. So we'll be sending out a reminder within the course of next week on the same. So at that point, I want to appreciate each and every one of us for attending this training this afternoon. Feel appreciated. Looking forward to again interacting with you next week on Thursday. Thank you very much and have a lovely afternoon. Bye.
Thank you and bye.